Welcome to Your Gray Matters, the podcast that unveils the miracles already amongst us. Here, we believe that the human mind cannot be defeated. Tune in to discover the fascinating people with extraordinary stories, innovative products, and groundbreaking services. With your host, Neil Silvert, who's earned his gray hair and still has use of his gray matter.
What if the final step in healing after cancer wasn't medical? What if it was art? Healing sometimes comes from medicine. Sometimes it comes from surgery. And sometimes it comes from something as simple and powerful as art. Imagine surviving cancer. You've gone through surgery, chemotherapy, fear, and months of recovery. The doctors tell you that you're finally cancer-free. But when you look in the mirror, something is missing. For many breast cancer survivors, the final stage of healing isn't another surgery. It's something unexpected, art. Hi, everybody. I'm Neil from the Your Gray Matters podcast. Welcome back. Through a specialized technique called medical tattooing, artists can recreate the natural appearance of a nipple and an areola after mastectomy surgery. Many women say it finally allows them to feel whole again. My guest today is Marlana Laffita of ML Beauty Company, a medical and cosmetic tattoo artist dedicated to helping people feel confident in their own skin. She specializes in 3D areola tattoos for breast cancer survivors using advanced techniques to create natural, realistic results after mastectomy and reconstruction. For many of her clients, this final step restores not only the appearance of the breast, but something much deeper: identity, confidence, and emotional closure. Marlana, welcome to the Your Gray Matters podcast.
Thank you, Neil. Thank you for having me.
We're really glad to help you, Marlana. So, Marlana, let's jump right into this. And everybody, I've known Marlana for quite a while. She's an exemplary person. She's high quality artist, obviously, but a great, confident person. And we're glad to have you on, as I said.
Thank
And
you.
let me jump right in and say, what is medical tattooing and how is it different from traditional tattoo art?
So, medical tattooing, a lot of people have never heard of before, and it has to do with medical. So, anything with my career is areolas, the 3D areola, and also scar camouflage, scar reduction. We can tattoo your scars to look like your skin again, but we can also revise them and heal them a bit to change the texture. So that's basically your medical tattooing on belly buttons for people who've had a tummy tuck or surgery, or some of these ladies lose their belly buttons when they get their diet flaps, their reconstruction. They take it from their belly, so they don't have a belly button, or they reconstruct their belly button and it looks a little different. So we can tattoo that. We can tattoo your areolas. We can revise your scars or stretch marks, and also camouflage your scars.
So, Marlana, I imagine that this is not just for women. I guess men experience the need for your services too.
Absolutely. So men can also get breast cancer, where a lot of people don't think about men having breast cancer, but it is out there and it's on the rise. So imagine being on the beach and taking your shirt off and you don't have your areolas or nipples visible, just your scars. So we can help their confidence too. And it's not just breast cancer, it's any cancer where you have scars or any surgery, self-harm. You know, people want to hide the trauma, and we can help them with that with medical tattooing.
So fascinating. So let me ask you, what training do you go through to get to where you are?
So where I started was in cosmetic tattooing. I've never tattooed anything in my life before that, which is most people know eyebrows, eyeliner, lips. We can do freckles. And from there, I met a lady with cancer who had lost her eyebrows, and I tattooed her eyebrows on. And the difference in her personality and the reviews she gave me actually brought me to tears. And this was a friend of mine. I had no idea she felt so self-cautious about what she looked like after she had recovered, thank God, from cancer. So that made me think about what else could I do? I wanted that feeling again of how that helped her regain her confidence and her self-love again. And I found a wonderful instructor out of Toronto, Laura J. Beauty, who is amazing, amazing talent. She has people traveling from all over the world to come visit her and train with her or to get her work done. So I trained with her be a year and a half ago now, and it was just amazing. It changed my life. So we train, we learn color theory, skin anatomy, scar anatomy, all the verbiage for cancers and what types of cancers there are, what doctors are involved, color theory, and you practice and you practice and you practice and you practice and you practice. In no way when you're done a course are you ready to walk out and start tattooing somebody. So it was about, for me, although I still was doing cosmetic tattooing, it took me about 6 months probably to feel confident and to
Hmm.
have my mentor say, you are now ready. You're ready to go do your first client. So many, we practice on latex.
Yeah.
So something like this, it's a fake skin. These are upside down, like tons and tons and tons. And there's different skin tones. There's darker skin tones. Of course, not everyone's the same color. We can hardly see this one, but yeah. So we do
Wow.
this, and I literally have stacks and stacks of practice work
Wow.
like that.
So you're really bringing people back to life, not just physically, but emotionally, and how they're feeling about themselves and how their families are
Absolutely.
feeling about all this. I I
Absolutely.
I I I guess I could jump in here and just say that someone very close to me lost her hair, and she's since gone out and had tattooing done on her head that made her look like she has hair.
Yeah,
And it's phenomenal. She looked totally different and she became totally different.
100%.
Really interesting. Let me ask you, are you considered a health professional? Are people what you do there
I
yet?
wouldn't say we're a health professional. I think it's moving closer to that. There are some doctors and nurses that offer this service, but they're not that specifically trained. It's not the art that we are trained in. So I would say no, it's not medical. In the States, you can get it covered through insurances, but here, unless it's a doctor doing it, we're on our own.
But since it's not medically recognized yet as a regulated medical profession, what should someone look for to ensure that they're choosing a properly trained artist?
Talk to your artist, ask for work, ask for some before and afters, ask if you could have permission to maybe reach out to some of their clients that they've already done and see what their thoughts and comments would be. Reach out to their instructors, do your research online. Do your research. So, I mean, we normally post our work if we don't get tagged and flagged, but our work is on there. You just have to do your due diligence and look around. I had one lady that was booked with someone else that came to me, and it ended up the other person, I'm not going to mention names, but the other person was not ethical, and it was good that she changed. So do your due diligence, check where their training was, check their health board, make sure they're sterile and clean because that's important, especially with a cancer survivor. Even though they've made it through and they've been cancer free, their immune systems are still compromised. So you have to be very, very clinical when you're doing it.
I know you to be very professional. But I think you mentioned that medical professionals do refer people to you.
Yes. So when I first started this, I reached out to doctors, to plastic surgeons, to clinics, to cancer assistance programs. I do a lot of cancer runs and cancer walks. I have booths out. I mean, even just informational pamphlets so people can know what's out there. A lot of people don't even know it exists. So I'm here to answer questions. Even if you don't choose me as your artist, I'm happy to answer questions and walk you down that path and just give you more information on what's out there and what's available.
So nowadays, of course, people, when they hear tattoo, they think of body art, which it is. but yours is really restorative work. It's a
Restorative.
very,
Yeah,
very different thing.
absolutely.
So I know that you specialize in 3D areola tattoos for breast cancer survivors. How does that process work, Marlene? If you could somehow explain it, how do you create that realistic 3D illusion? Would that be the right word?
Lots of practice. So, I mean, that's what we're taught. That's what we're taught. It's all shadows and highlights and lowlights and, natural colors and just knowing what the actual, I looked at a lot of breasts, let me tell you.
Yeah,
Knowing what an actual breast looks like and being able to replicate that because it's not just a client with a bilateral mastectomy where you can just match it on your own. Some have a breast still where you have to match what they have naturally to what you're tattooing. And that's a special thing all on its own. So a lot of practicing, a lot of embarrassing my friends, I would say, to ask them to show me their tatas so I can
yeah,
practice or take pictures and
yeah.
send them to me, stuff like that. Just a lot of practice, a lot of good training. I think that's the most important is your trainer needs to be good at teaching, not
Yeah.
just at her craft.
I
Uh,
was going to say somebody has to explain this to the student and,
exactly.
of course, to the patients more than
Yep.
anything.
Yep, we start drawing on paper, we start learning shading, we start learning definitions, what the wordage is or the verbiage, and then we start getting into the tattooing and it's just knowing the right cartridges to use, the right light systems and, like get the lights and shadows properly. I mean, there's a lot to it, but it's once you get it, it's becomes your muscle memory. It's second nature in the end.
Sounds like a real health profession to me, actually. And that's meant as a big thank you to you and your colleagues. So I heard you on another podcast, a very good podcast, and you told the story of one lady's reaction to all this. I was so moved. Would you mind to take us back to that moment and tell us
Sure.
what was happening in that room?
Yeah. So I had a lady I met at a cancer run. So she was running for cancer. She wasn't going to come that day, and she was actually the woman I was telling you about that was booked somewhere else. And she came. She just didn't feel comfortable with it. She was trying to talk herself into it, but came to the cancer run, and I had my skins out that I showed you, and we were standing there, my partner and I, just talking to whoever wanted some information. And she saw it and reached out to me and came in for a consultation. So we always start with a consultation. In person is best because I can actually see your skin. But if you're a distance and you want to do it virtually, we can do that as well. So she came in originally with her best friend and she was, do you want me to step out of the room? Nope, I'm fine. Threw her clothes off like it was nothing, put her little bib on that I give you. And, we were talking about it, taking pictures, and she was joking around with her friend. And we booked our appointment. And she came back with her boyfriend the next time for support. Same thing. Was totally confident walking around like it was nothing with, her top wide open. We're mapping her out and she's laughing and we're all talking. So we finished the tattoo and she stands up and she sees it. And of course, it's a very emotional. I mean, we always cry. Like the stories you hear while you're doing it and you get to, you come in strangers and you leave besties because you're doing something very personal for these people. And she looked in the mirror and at first she just stood there stunned. And then she started getting closer and she started like really checking it out and she's like, "I can't believe how real these look." And that's when it happened. All the tears started coming and you can't believe what you just did for me. Like this is amazing. This is my body back. She all of a sudden closed her jacket that we give you and she's holding it shut and she's talking to her boyfriend. She's talking to me. And I said, "What happened? Why are you all closed off now that you have them? You can see what they look like." She goes, "Yeah, but now it's real. Now I'm shy. Now they look like me again. And now I'm showing off my breasts." And she felt shy. And I thought, well, there you go. Now it's back. She actually texted me a little review that said, every time I walk by the mirror, I give a smile, a happy sigh, or a screech when I see it because I can't believe that's actually me now. I feel like Pinocchio. And I said, "What do you mean by that?" She goes, "I feel like a real person again." So what you
It's
give
a
back to these
blessing.
women is just, I get goosebumps every time I tell the story. It's
Yeah,
just amazing,
I've had them since the first time I heard you say that, and I
Yeah.
wanted our viewers to really hear that. It must have really affected her boyfriend too, I would imagine.
He was so sweet. I think he would have loved her no matter what. But yeah, like, I haven't actually asked that question. It's like,
Mm,
"Hey, how does your honey like them now?" But, when she was at home and I was checking up on her, so I always do a follow-up a few days later, make sure you're healing well, you're feeling okay, how are how's it going? And she sent me a picture of her boyfriend like this. So,
wow,
she got the
wow,
2 thumbs up from him as well. So,
that's
it was sweet.
amazing. Yeah, sweet, but dramatic and
Mhm.
important. Wow,
Mhm.
well, congratulations. I'm so happy for this lady. It's
Yes.
terrific, and for everybody. That's a great question. Do you call them patients, or what do you call these people?
Clients. I call
Client.
them clients. Some people call them patients. I just call them
Okay.
clients. I mean, when they're through with it all, I usually call them friends, you
Yeah,
know?
I get
We
that.
keep
There's
in we chat, like they're always giving you the thumbs up when you've posted a different person getting their stuff done and congratulations. Like it's a big I don't know, it's a community in a way where everybody kind of cheers everybody on. And once you've done it and you're following it, you're helping everybody else and you're
isn't
complimenting and engaging with everybody else. So it is a very big community, and these ladies totally support each other and uplift each other through it all.
isn't this amazing? Well, good for you. Well, let's move on a little bit from the marvelous work that you do with cancer. And let me ask you about scar camouflage, because you do that. So,
Yeah.
what is it, and what kind of scars can be treated?
Pretty much any scar can be treated. And I had always thought I wanted to do it. I actually did a little online course with it and it was okay. I got the basics and the fundamentals, but nowhere near what I needed to proceed ahead. And every cancer patient or breast cancer survivor, I shouldn't say patient, breast cancer survivor that I've seen always ask, what can you do with my scars? Can you hide my scars? Because a
Mhm.
lot of them have, like, the cutouts here. They've taken the skin from their bellies. So they're cut from hip to hip. They have scars. They have radiation markers. They have PIC line scars. And they all want those gone. So I pursued that as well. So there's a lovely company that I use, and we have serums that we can put in first, so we can lighten your scar if it's too dark. We can take the scar that's normally lighter than your skin tone, and we try and heal them a bit first before we camouflage them. So it's reducing the texture, it's brightening the ones that are dark. Stretch marks, same thing. It gets your body to produce the collagen it needs to even it out to your skin tone, and then we have the pigments that go in, and we match your skin tone pretty much perfectly, and we tattoo that scar to match your
Isn't
skin tone, so it blends in more.
that amazing? I was wondering, scar tissue, does it behave differently than normal skin when you're working on
Absolutely,
it? Yeah.
absolutely,
So
and
it must be tougher to work with.
it can be harder to implant pigment for sure, and then sometimes it can react really sensitively, I guess, for lack of better words, where it reacts like it's angry or it's just sometimes doesn't wanna take the pigment, but anytime you break into a scar with needling of some sort, especially if you're using serums, it's helping to repair that scar. Whereas
Really?
that's
That's
what
interesting.
microneedling way back in the day, I mean, still people microneedling. So microneedling is causing your skin injury where your skin puts out collagen to heal itself. And if that's on a scar, then it helps with the scars.
Wow.
And we've taken it a step further where we have serums that are healing that we tattoo into that scar to help that process speed up.
And I'm curious because would you use your services, say, for breast reductions or gender affirming?
Absolutely. Yeah.
Wow.
Gender affirmation and all that, gender people who have, gone through that top surgery, they need that as well to feel whole again in the end.
So, and you just said it, people are feeling like they're reclaiming their bodies, I guess.
Absolutely.
Yeah.
They're
So,
reclaiming their bodies and their own self-worth and self-power, their confidence levels, their self-love, when you're or a single woman especially and you don't have a spouse, like that was another big thing was, I'm going out dating, I make sure all the lights are out and everybody's got to be in the dark, and I don't want anybody to see anything because they don't feel like it's sexy anymore, and then they can get this done now and feel like, okay, I am a sexy human being still.
wow, it's so important at all ages, isn't it?
Hmm.
And wow, so interesting. And I imagine, just like that lady who you spoke about, and as you just said, for all of them, their life experiences have to change, hopefully for the better. So you're playing a major role in people's lives. I knew I wanted to put you on
They
this
play a
show.
major role in mine as well,
Yeah.
like, yeah,
Well, I wanted to ask you just before we go on to another part of tattooing. It does affect you, right, Marlana? It
absolutely.
has to. Can you talk a bit about what it feels like to do what you're doing?
It changed my life, basically, and I know that sounds big, but it was big. When I first went into this course, they had a candle. It was like, the torso of a woman from the neck to the waist with breasts, and these candles were sitting in front of all of us, and we thought, "Oh, cool, nice candles," and she said at one point, "There's an X-Acto knife on the table in front of you. I want you to take it, and I want you to cut one of the breasts off the candle."
Hmm.
And we were like, "What?" She goes, "No, go, do it." And everybody's sitting there holding their candles and holding their little knife, and nobody wanted to do it. Like, we were all staring at this candle, and I finally put the knife to the wax, and I had tears rolling down my face. And she said, "Okay, you can stop." Now imagine a doctor told you that you had to have your real breast removed. Look at the emotion you had from just cutting it off a candle. And that I just went, wow, like this is going to be big. And just the more we did, and I mean, she works on live models for you as a demonstration, and these ladies that were coming in and the stories that we're telling, everybody's crying, everybody's sad and kind of nervous at first, and then you see them getting lifted and changing as this is happening. And when they see themselves in the mirrors, of course, you have tears again, and then you have the hugs, and then you have the whole emotion of that, and watching how they've gone from this to this in a matter of hours. And I always say, with this little thing we do, and it feels like a little thing sometimes because it's a tattoo, but it's such a huge life-changing event for both of you. Like, I will never be the same again with the stories I've told or stories I've heard, and watching these ladies thrive now, for lack of better words, to go out there and feel more confident about who they are and what they do, you know?
I was just curious, and thank you for sharing that because I mean, I'm shaking inside for what you're doing for people. Is your industry, if I can call it that just for a minute, your profession, is it accepting men to do these? Is there any lack of comfort with men, like many medical professions?
Good question. I don't personally know of any men that do it. I'm
Mm.
sure there are some out there that should. As long as your client is comfortable, I can't see why men shouldn't be doing it.
Okay. I was just curious because
Yeah.
obviously it's going to be a growing profession.
Yeah, very good question. Yeah, I don't know of any. I'm gonna look into that. Yeah.
Well, very,
I
very
mean, some of the
interesting.
doctors do it, but they're a
Yeah.
doctor. So, I mean, I'm
Right.
sure some of the doctors are male that probably perform that, but as far
Sure.
as artists in the field out here, I don't know of any personally. There's not a ton of us. It's growing. There needs to be more because this is a huge it's huge.
So let's talk about that. How long is there a long waiting list to get?
For some, there is. I know my mentor is in Toronto, and she's packed. Like, it takes a while to get into her. I have no waiting list yet, but yeah, I would love to have one, but just so I can help more people. So that's my goal now, is if I had to choose, I mean, I love what I do aesthetically, cosmetically, and medically, but if I had to choose one, this would be it. This would be it.
And I guess that you really have to be available all hours of the day because some people who need your help are working during the day. So I'm just crafting a picture of how your profession works and when it works and your own fatigue levels. I find the whole thing fascinating. And in a way, if you'll understand this very respectfully, how sad that we need this in this
Yeah,
world, but we do.
absolutely.
And
Absolutely.
thank God that we have professionals. So I want to talk to you a little bit about cosmetic tattooing. And how does that help people feel more confident? What procedures do you offer? How does that all work?
So I do eyebrows, eyeliner, and what they call it, lip blushing. So a lot of the cancer survivors lose their hair. and they lose their eyebrows, they lose their eyelashes. And this is how I got started in the medical field. Is I had a friend of mine come and say my eyebrows are horrible since I had radiation and chemo and they're crazy. And when she gave me the review about how much different it changed her life and how much more confident she was and how big of a smile she had when she walked out of the house, I'm like, I need to do more of this for more people, which started me down the medical road. Just saving time trying to draw on your eyebrows when you don't have any, or your eyeliner when you can't see. You know, radiation sometimes takes your vision a little bit, or the chemo, you know, just all of that. Even for non cancer patients, just to have someone who has alopecia and has no hair,
Yes.
right? You know, their hair falls out, you give them eyebrows, you give them eyeliner, and that there's their confidence level back up. They're not walking around with not a hair on their face, you know? So it really makes a difference in some people's world. And that's how I got started is my cousin's wife tattooed my eyebrows. So I went, wow, like this. I fought it for a while, and when I finally did it, I said I need to learn how to do this. This is
Slow
something big.
moving. Well, as I told you, a friend of mine, she lost her hair, and you just reminded me also her eyebrows, and she had it done. I think she had her lips done too, come to think
Hmm.
of it. I just saw her recently. She's a different person, not
Absolutely.
just a look at, but her confidence, her posture, the way she walks. I mean, really interesting.
Yeah.
And it brought great relief to her husband, by the way. Great relief. Not
Yeah.
not for any reason that he wasn't comfortable looking at her, but he was so thrilled by her happiness.
How happy she made her. Absolutely.
The emotion in the house is so different now. So
Yeah.
really, congratulations. So I guess cosmetic tattooing, though, I don't know how to ask the question. Is it becoming more mainstream? Like,
Cosmetic
peop-
tattooing has been around forever. You'd be amazed at how many people actually have eyebrows done that you don't. I mean, when I got into it, it's like that car, you don't never seen a red Honda and you buy a red Honda and they're everywhere.
yes,
You know, it's the same idea. I didn't know about eyebrows. I got my eyebrows and now everybody I see has eyebrows. So, I mean,
wow, wow.
it's a pretty big thing. I'd say eyebrows are probably the most popular. Um, Eyeliner and lips are a very close second. I mean, I have all three of mine done. It's wonderful. It saves me
Hmm.
time. I go to the beach. I don't have to worry about mascara. I don't have to worry about drawing on my eyeliner. I don't have to worry about my lipstick falling off. You know, it's
Wow, wow.
saves time for sure and money in the end without having to buy lipsticks and eyebrow pencils and, you know,
I was going to say you're messing up the whole
you're
lipstick
messing up the whole
industry.
cosmetic community. I mean, in no way is it a replacement for your makeup. It just
Yeah,
enhances what you do anyways. Like, you know,
sure,
some people
sure.
say, well, I still have to draw my eyebrows on. Well, yeah, maybe, but you don't have to try and make them even or, you know, find the right shades or
Yeah, it's
it's
also almost coloring within the lines, if
yeah,
you will. I think
yeah,
that's
exactly.
very, very interesting. Is there any part of the body that can't have medical tattooing?
In yes. So I close to your eyes. I mean, you can get in there. I mean, obviously I tattoo eyeliner, but I mean, I shouldn't even say that because there's tattooing for dark circles and they get right up under your eyes. So probably
Really?
not many places you could not get to through medical
Wow.
tattooing.
Fascinating. Thank you,
Yeah.
Marlene. So tell me about the Healing Ink Collective. What are they and what's the work that they do?
So they're a wonderful bunch of women that founded this group called the Healing Ink Collective. There was 5 founders. A few of them are just your, you know, not just, but your marketing people and your advertising people and your brainstorming people, and a few artists themselves are involved in it. And what they've done is they've vetted in medical tattoo artists, mainly right now the Areola tattoo artists, to do mass tattoo days. So what they're offering is you apply for this if you need your tattoos and you're vetted in. As an artist, you're vetted in. You had to support your work. You had to supply that. They judge your work and then you're accepted. So I was honored enough to be accepted as an artist into this collective. I was brought in late, so I never tattooed at the first event they held, but there was 5 artists that day in Etobicoke who tattooed 12 survivors, Areolas, that came to completion that day. Like, I just got goosebumps.
Wow, what
Um,
a
what
collective
an
of
emotional day,
people.
and these ladies are absolutely wonderful. They're wonderful artists. One of the ladies that was there was in the class with me when I took this course, and of course, my instructor was one of the artists there. It's just an amazing day to be able to give this back to these women, to watch these women come in, usually in groups. There was 5 artists, so they came in groups of 5, and to watch them sit in the waiting room, and the posture, was kind of closed and quiet and nervous, and have everybody come in and they're all in a same room getting done. Everybody's talking, everybody's telling you stories. There's people walking around with cameras. I mean, it's a little uncomfortable. And
Yes.
then when someone is done, someone screams out, "We have a reveal." The room stops. The
Wow.
ladies on the bed sit up, the artists watch, and these women get walked up to a mirror with their artist and get the reveal of their completion of their areola tattoos. And
My.
everybody is cheering and dancing, and the music's loud, and it's all, to watch them go out after that and the difference in their personalities. You
It's
can't
mind
give a
blowing.
better gift to somebody than that. But
Yeah.
it's a wonderful group that they're trying to spread Canada wide. Right now, it's just on Ontario. So there's another collective coming up. I believe it's in October. Don't quote me on that. But what they're planning to do is
You
keep,
just got quoted on the podcast.
yeah, well, don't hold me to it.
I
I
know
think
what you
it's
mean.
October. So yeah, the it'll be on my website, and what you do is you apply to the collective, and they accept you as one of their clients for that day, and you get your areolas tattooed for free.
Congratulations to everybody, and it's very moving, and it should be across Canada, and I hope that it continues to grow.
Oh, it
I
will
just
be.
I
Yeah,
just have a couple of things to ask you before we wind down
sure.
because, and thank you for doing this. This is really remarkable. So, what do you say to someone who's really struggling with this? They're listening to you today on the podcast. They're struggling though. They don't know what to do with their body image. They've had surgery, maybe trauma. What can you say to them just to invite them to try this?
Reach out. Reach out. You don't have any commitment. There's no pressure. There's no judgment. We're a judgment-free zone here. It doesn't matter any question. No question is a dumb question. We're here for you. We're here to answer your questions. We're here to guide you. And if you choose to do elsewhere, then you choose to do elsewhere. That's not going to offend me. I just want to educate people on what's available to them and how they can possibly go about getting this done, where they can go in their area if they're not local. Yeah, like I said, just reach out and start a conversation.
Fantastic. Thank you. Just have one more interesting question or comment. I guess after working with so many survivors, they must have taught you something about resilience.
Absolutely. Absolutely. I don't know. These are some of the strongest people I know to go through what they went through and come out on the other side and still always have that fear that what if it comes back? There's a 5-year marker that if you can make it 5 years, you're
Mhm.
usually good, but it's come back after 10 years. To know from the question to going to the doctor and asking, to the diagnosis, to the surgeries, the chemo, the radiation, and not just one surgery. You're getting your life-saving surgery, then you have your reconstruction surgery. Then you have, if you choose to do what they do, a nipple mound, you can have those built back in, which is just skin again. I mean, there's a lot of surgeries and a lot of trauma, a lot of fear, chemo, radiation. It's a world of emotion. And when you come out the other side healed and you still don't feel like yourself, we're there to help you get to that end goal and start feeling like yourself again. I hate the word normal, but it's the word they use. I feel normal again.
Yeah.
I feel sexy again or confident again. And you've given me my life back. You've
You
given me
feel
my
yourself.
sexuality back. I feel
Mhm.
sexy again. I don't want to hide from my husband. Like it just, you changed their life. We didn't save it. That was the important part the doctors did for them. After all that struggle and all the fight, the fear, the worry, the family that has to fight and fear and worry with them, to come out on the end and you're cured, and to get that final stage done that you can feel like you have your life back again is just the best gift I can give somebody. It's the best gift that can give me, that I can feel that way, that I've helped them through that.
Well, and I want to thank you for coming on talking about this because frankly, you've given all of us a gift tonight by telling us about this. I'm so thankful that you came on, Marlana. If people want to get a hold of you, and we'll post your info, but what's the best way to get a hold of you? And folks, I encourage you, if you're not sure whether you should call or write to Marlana, let me suggest you should. So what
Okay,
would be
yes. I have my Instagram, which is mar.mlbeautyco. Same as my email is mar.mlbeautyco@gmail.com. Facebook is under my old name because Facebook won't let me change it. So it's browsing around on Facebook. You can use my phone number, which Neil will post, 905-512-3594. So message me through Messenger, Instagram, phone calls, emails. I will answer you.
Okay, and thank you, Marlana. Thank you, everybody, for tuning in. And keep doing what you're doing, Marlana. And bless your heart for everything
Thank
you
you
do.
so much. Thank
Good night,
you.
everybody. Goodbye, everybody. And thank you for tuning in.
Thanks for watching. If you found it interesting and you liked it, give us a thumbs up. If you're ready to subscribe, click right here. And if you'd like to see another episode, click right here. Tell a friend. Send us comments. Thanks a lot.